Good morning. Today we'll talk about treatment to the psychological disorders, that it comes in the way of therapies, drugs, and medicine. So, long time ago, whenever somebody would exhibit some sort of a psychological disorder or something close to that, the matter in which it was addressed was using trepanine, which is the relief of pressure or release of the spirits possessing the individual. Thank God people don't do that anymore for the purposes of treating psychological disorders. In fact, we use psychotherapy, and it is any psychological technique used to facilitate positive changes in a person's personality, behavior, or adjustment. And it is usually based on a dialogue between the therapist and their clients. And understanding the client's perspective in order to help the client restore hope, courage, optimism, potentially gain insight, resolve a conflict, improve one's sense of self, change unacceptable pattern of behavior, find purpose, mend in interpersonal relations, learn to approach problems rationally, etc. And actual individuals say that 9 out of 10 say that the lives actually improved. They started feeling better after 8 to 20 potentially weeks of sessions. But the biggest element is that because of the costs and the limited insurance, clients can actually receive only 5 therapy sessions, which actually leads to only 20% of people who seek psychotherapy to actually feel better. Psychoanalysis is a Freudian therapy that emphasizes the use of free association, dream interpretation, resistances, and transference to uncover unconscious conflicts. The problem with psychoanalysis is it takes too long. Patient might experience a spontaneous remission of symptoms that might not be because they attended the psychoanalysis, but because, time has passed. Things have changed. So it's not necessarily that the psychoanalysis actually helped. And also, there's limited hard empirical research that supports that this approach compared to other contemporary therapies is actually more helpful. Please stop now and check out the short video of a professor from, can't remember the actual university he's from. He's psychoanalyzing Batman. And I thought it was a kind of interesting perspective and demonstration a little bit into the world of psychoanalysis. Humanistic therapies believe that humans have a natural urge to seek health and self-growth. And there are 3 types of therapies under the humanistic therapies category. The client-centered therapy is a non-directive therapy based on insights gained from conscious thoughts and feelings, and it emphasizes accepting one's true self. So therapies don't necessarily try to fix clients. Clients need to try and solve their problems actively. The therapist does not make interpretation, but just reflects on what the client says. So how do you feel about that? What do you think it means? Etc. Existential therapy is an insight therapy that focuses on the elemental problems of existence, such as death, meaning, choice, and responsibility, and it emphasizes making courageous life choices. In this case, the therapist helps clients to discover self-imposed limitations in personal identity. Clients are challenged to be mindful of their values and choices and to take responsibility for the quality of their existence. The gold stack therapy is an approach that focuses on immediate experience and awareness to help clients rebuild thinking, feelings, and acting into connected whiles. So it emphasizes the integration of fragmented experience. This type of therapy is more directive than the client-centered or existential therapies. However, it's less insight-oriented. It potentially helps clients to become more aware of their moment-to-moment thoughts, perceptions, and emotions. So rather than understanding why they're having these emotions, the therapist encourages the clients to actually experience these emotions in full. Cognitive um, therapy tries to directly change people's the way they think and feel and believe. While the previous ones we talked about is the psychodynamic and the humanistic therapies, they try to foster insight. Cognitive therapy, in particular, is a therapy directed at changing the maladaptive thoughts, beliefs, and feelings that underlie emotional and behavioral problems. And And depression, for example, is an example of how the cognitive therapy can help depression. So it includes selective perception, overgeneralization, and all or nothing thinking, right? What depression is basically. So what cognitive therapy does, it's correcting these negative thoughts. So instead of thinking all or nothing, kind of seeing the in between. So challenging that all or nothing thoughts. Cognitive behavior therapy is an approach combining both cognitive, so what the cognitive therapy does, and behavior therapies to optimize treatment outcomes. For example, if somebody has the behavior of hoarding, so collecting elements, you can use cognitive behavioral therapy by correcting both the distorted thinking about hoarding, but also actively modifying the actual hoarding behavior. Behavior therapy is any therapy designed to actively change behavior using learning principles. So there's no need for a deep insight for an improvement. It doesn't necessarily need to understand why somebody behaves in a certain way, but rather addressing the actual behavior, how to change the actual behavior. So behavior modification is used very frequently in behavior therapies, and it's any use of classical or operant conditioning to directly alter human behavior. So using aversion therapy, systematic desensitization, token economies, and behavior activation. So what do those actually mean? So aversion therapy is suppressing an undesirable response by associating it with aversive, so painful or uncomfortable stimuli. For example, shocking somebody. Every time you take a sip of your alcoholic beverage, soon you will learn to associate that drinking alcoholic beverage might be associated with shock, so you might not drink as much, for example. Systematic desensitization, a reduction in fear, anxiety, um, or aversion brought by planned exposure to the aversive stimuli. So, for example, you can construct a list of your anxiety, and let's say you are afraid of heights. So you start tackling that fear slowly. So, for example, you stand on a chair. Relatively, it's a small considered height, but still a height. If you're okay with that and slowly overcoming that, you might stand on a table next. So, like, by slowly addressing the problem, the behavior that you're trying to not have anymore, you're systematically desensitizing yourself to that fear. Token economy is a therapeutic program in which desirable behaviors are reinforced with tokens that can be exchanged for goods, services, activities, or privileges. So money, for example, would be considered a token economy example. Medical therapies. Considered drug therapies, and it's the use of drugs to treat psychopathology. there are some benefits to medical therapies. It shortens hospital stays and improves changes to recover from major psychological disorders. However, there are some limitations with drug therapies, and it's that you can develop neurological disorders, fatal blood disease that are a direct cause from the use of the drugs. And also, it can help, but it not necessarily can cure it all, kind of. Brain stimulation therapy is another example of medical therapies, and it's altering electrical activity of your brain. So it basically helps to alter or reset the biochemical and hormonal balance in the brain and your body. So basically, kind of having a small amount of electrical shock into your brain, and as I said, it kind of resets potentially some chemicals and hormones in your brain that might be the potential cause to the disorder you might be experiencing. And it does help to the degree that at least it produces some temporary improvement. And finally, psychosurgery, and it's any surgical alternation of the brain designed to bring about desirable behavior or emotional changes. For example, having prefrontal lobotomy, as depicted in the picture, is having the frontal lobes surgically disconnected. And potential limitation is that some patients show no changes or become actually their mental activity stops to exist. Production of seizures, major personality changes because of that. And mostly this type of medical therapy is not done today. What they do is deep lasering, which small targets areas are destroyed in the brain's interior, rather than actually doing a full prefrontal lobotomy. But this type of medical therapy is usually left as more like a last resort, because this is kind of, in some cases, as I noted in the limitations, there is sometimes a no point return. So in addition to presenting you these adorable pictures of puppies and kitties, I found a pretty awesome TED Talk talking about depressed dogs and cats with OCD, and what it means, not necessarily only to the animals who might be suffering the psychological disorders, but actually what can we learn from the animals with these disorders about us for human beings. So definitely check out the link to the TED Talk. That's all I have for you for treating psychological disorders.